Hi, today we are going to discuss about this ventricular system. As you can see, this name suggests ventricles. Here is the sagittal section of brain. Actually, as we know that brain consists of the four ventricles, that is lateral ventricles, which are present in cerebral hemispheres, and next one is third ventricle, which is present in diencephalon, that is in thalamus, and also the next one is fourth ventricle, which is present between the pons and cerebellum. So yeah, these two ventricles, the two lateral ventricles are communicated by this interventricular foramen, that is today we are going to discuss about this ventricular system. As the name suggests, the brain consists of the ventricles. We know that the brain consists of four ventricles, that is two lateral ventricles in cerebral hemispheres, and also third ventricle in diencephalon, that is in thalamus, and fourth ventricle between the pons and cerebellum. And the ventricles communicate via the lateral ventricles, and third ventricle communicates via interventricular foramen of Monro, and the third and fourth communicate via cerebral aqueduct. We can see here in the picture that this is superior sagittal sinus, lateral ventricle, foramen of Lashka, that is lateral aperture, and for fourth ventricle, and also this is subarachnoid space completely, and here it is foramen of Magendie, which is medial aperture, and also choroid plexus, which secretes cerebrospinal fluid, and here is arachnoid granulations, where this cerebrospinal fluid returns, and the cerebral aqueduct is blocked in children, as we know that, and also the CSF which is produced by the choroid plexus is in fourth ventricle. We can see this, and also the CSF draining into the superior sagittal sinus and also into the arachnoid granulations. This is the site where the CSF returns. These choroid plexus consists of choroid epithelial cells, and is present in lateral, third and fourth ventricles. In all ventricles, this choroidal plexus is present for the secretion of this CSF, and the tight junctions between these forms this blood CSF barrier. It also has this blood brain barriers, where we have the extensions of the astrocytes and all. As the CSF is in the subarachnoid spaces, from here it goes completely around this and passes to the venous circulation by arachnoid granulations, and then into I'll write here. The CSF goes into this subarachnoid space and then goes out via this arachnoid granulations to this venous process into dural venous sinus, and the sinuses here are, we can see here in this picture that superior sagittal sinus that is where this flax cerebri, superior part of this flax cerebri is the superior sagittal sinus, and inferior to this, down to this, is inferior sagittal sinus. And what happens is this superior sagittal sinus drains this CSF into the two transverse sinuses, and then to writing here, superior sagittal sinus drains to two transverse sinus and into sigmoid sinuses. Each sigmoid sinus exits via skull, that is jugular foramen, as an internal jugular vein. That is how it goes out by superior sagittal sinus. And next, inferior sagittal sinus. In this, it terminates by joining cerebral vein. It joins with the cerebral vein of Galen to form a straight sinus. And then this is how it drains. Next comes this cavernous sinus. In picture, this inferior subarachnoid space, flax cerebri and all, yeah, cavernous sinus. This is nothing but the group or the venous plexus on the either side of the sella turcica. This is famous for pituitary, and also this is surrounded by internal carotid artery and internal carotid artery, and by some cranial nerves like 3, 4, 5, 6. So this cavernous sinuses drains to transverse sinus via superior petrosal sinus, and this drains to transverse sinus and also to internal jugular vein by inferior petrosal sinus. Petrosal sinus, not petro. Cavernous to internal jugular vein by inferior petrosal sinus, and cavernous to transverse sinus via superior petrosal sinus. And as I told, I'll repeat again about this superior sagittal sinus and inferior sagittal sinus. Superior sagittal sinus drains to two transverse sinus, where this drains to sigmoid sinus from this confluence sinus. And next here to internal jugular vein by jugular foramen. Internal jugular vein. And also inferior sagittal sinus combines with the cerebral vein of Galen, and it forms straight sinus This straight sinus is at flax cerebri and tentorium cerebelli junction. Yep. And now let's talk about this cerebral spinal fluid amount and how much it is present, distribution and circulations and all. This CSF, as we know, is secreted by this choroid plexus, that is almost 400 to 500 ml is produced daily, but we can see an average man or an average adult has 90 to 150 ml of cerebrospinal fluid, and we can see 25 in ventricles, 25 ml in ventricles, and 70% we can see this produced by choroid plexus, and remaining 30% is nothing but water. This choroidal plexus also ependydymal cells. These consists of which are present in this ventricles. So these choroidal plexus are located in all parts of the ventricles, lateral ventricles, third and fourth, and these CSF passes from each ventricle to another ventricle by foramens, and the CSF can leave and enter to the subarachnoid space and outside to the CNS are only by 3 openings, that is fourth ventricle, lateral ventricle, and 2 lateral foramina of Lashka, that is lateral aperture, and the median aperture Magendie, and yeah, the CSF returns completely into the venous system by this arachnoid granulations, as I told before, that also into the superior sagittal sinuses, dural venous sinuses. And coming to the CSF, this CSF is very clear fluid which is isotonic with serum, and the comparison here is done with serum only, isotonic with serum, and the pH level of this is almost 7.33, that is for artery it is 7.40, and for venous blood, that is 7.36. this is below this venous blood, that is 7.33, and we can also find this sodium concentration. CSF is almost equal to serum sodium concentration, and also but this CSF and serum, the CSF has higher concentration of chlorides and magnesium ions, but the CSF has lower concentration of potassium, calcium and bicarbonate ions, and also glucose. So these blood CSF barrier, as I told before, that it is such a mechanism to protect from this chemicals of the brain, chemical integrity of the brain, and these tight junctions which are present in the epithelial cells of this choroidal plexus forms this blood and CSF barrier. This transport system is similar for the blood brain barrier, but we cannot tell whether the drug goes into this CSF or not. That depends. And there is concentration of proteins also, which is much lower in this CSF compared to the serum, and there might be the presence of 0 to 4 lymphocytes or mononuclear cells per cubic millimeter, but few monocytes or lymphocytes is normal, but the presence of polymorpholeucocytes is abnormal, which may result in bacterial meningitis. And red blood cells are not found in this CSF, but may be present after this traumatic spinal tap or subarachnoid hemorrhage. And increased protein levels in the CSF may cause CNS tumor, and tumor cells may be present in case of this meningeal involvements. And also, if we come to this types and features of this hydrocephalus, we know that hydrocephalus is of non-communicating and communicating. Normal pressure is also present, and ex vacuo. Coming to this in detail, so yeah, this non-communicating, we saw this in Dandy Walker and Arnold Chiari and all. So in this there is a obstruction of flow within these ventricles, like foramen of Monro, foramen of other foramens, and cerebral aqueducts, openings of fourth ventricle issues and all. In this communicating, we can see this lack of or low or impaired CSF reabsorption in arachnoid granules. These may lead to this meningitis, and also normal pressure, which is chronic form in this CSF, is not absorbed by this arachnoid granulations, but also we can see this normal pressure because there is a dilated ventricles which balances that pressure. Ventricles dilate here, and this has classically 3 signs, that is triad signs. We can call it wacky, wobbly, and wet. This is because this wacky due to this dementia which is seen here, and wobbly is due to apraxic or magnetic gait, and this wet is due to the urinary incontinence and all. So we can see here that as these neurons dilate, as these ventricles dilate, we lose neurons. Neurons loss can be seen here, and this magnetic gait can be confused with the Parkinson's disease, but the only difference here and there is they both shuffle. The common thing is that, but they don't have bladder problems. And also we can see bradykinesia, that is movement of hands and all in Parkinson's, but this may be confused due to this magnetic gait. So next one is ex vacuo. This is nothing but excess of CSF. We can see here, and we can see the loss of brain tissue due to atrophy and stroke. These results in this dilated ventricle but normal CSF pressure as this here. We can see here. So that's it about this ventricular system, and in the next chapter we'll see the spinal cord in detail. So if you are new to this channel, please do like and subscribe so that it helps me, it encourages me. So like and subscribe.